Good morning, Miss Williams. My name is Brantley, and I'm going to be your student nurse today. I'll be here until 12, and I'm going to be taking your vital signs and doing a head-to-toe assessment. Is that okay? Do hand hygiene. First, I'm going to be doing your vital signs. I'm just going to raise your bed up a little bit. And I'm going to take your blood pressure first. And I'm doing one step.
Oh, here it is.
And on a real person, you would feel their brachial pulse, but on these mannequins, you can't feel it very well. You got 116.78. Now I'm going to feel your pulse.
I know I get it. Alright, Elizabeth, I'm gonna run upstairs real quick. That's fine.
Okay, I got 62 for your pulse. And I would take their temperature, but I can't. The vital sim, and I take their O2, but I can't. So now I'm going to listen to your respirations. And if it was a real patient, then I could just put their arm across them and watch their chest raise.
So unit for yours, you will not look at the legs that are attached to the mannequin, you will look at the legs that are next to the mannequin, okay? You will do your full head-to-toe assessment on the patient. These are your, orders for your patient. You can write those down, we'll use those to answer your questions that's in the Bible, as well as your assessment. So when you go through this, obviously he's not going to be able to talk back to you. But go ahead and verbalize what questions you'll be asking the patient as you do your head-to-toe assessment, and then just work your way down. Like I said, you'll use these to answer the questions that are in the board, and then you cannot assess temperature and pulse ox, but obviously we're going to take those, so that's something that you want to realize. Okay? You guys have any questions? Okay. There you go.
Got 16 for your respirations, and I wouldn't be telling the patient that I'm doing the respirations, but for the video, I was saying I was doing respirations, so you would know. And then can you tell me how much pain you're in from a scale of 1 to 10, with 1 being the, well, 0 to 10, 0 being the lowest and 10 being the highest unbearable pain you can? And if they tell me about their pain, then I would go into more depth. I'd ask about the quality and what it feels like and duration. So now I'm going to do my head to toe. And I would have gloves on. And I would feel around their head, feel for bumps and look for lice or bugs. And then I'd take off my gloves and I could do hand hygiene. And then I would look at their eyeballs and I could have a light and see if they're at pupils dilated or if they don't. I would look at their ears to see if they have hearing aids and see if there's any drainage in their ears. I'm also going to look to see if they're symmetrical. Then I can go to their mouth. I'm going to look to see if they have dentures on the top, bottom, or overall. And I'm also going to see if they have a dry mouth or wet mouth. Do you feel like your mouth's dry today? Good answer. And then do you have any problems swallowing? Then I could feel for their lymph nodes to see if they're swollen and that they're inflamed. Then I ask, do you have any heart problems? And then I'm gonna listen to your heart. I would put my stethoscope under. And if it was a real patient, you would try to go under the left boob, but you can hear better on their chest.
Hi, Mr. Morgan. My name is Savannah, and I'm your student nurse today. I'm going to be doing a head to toe on you. So I'll start by looking at your head, and I'll see.
And while I was listening to their heart, like afterwards, I could listen to their breath sounds also. So I'd be listening to their chest, and I already did that since I listened to their respirations with my stethoscope. And I'd move my stethoscope around too, and I'd also go to the back and listen to what their posterior sound sounded like. But since these Sims are so heavy, I'm just saying that I would listen to his back, well, her back, Miss Williams. And whenever I did that, I would check to see if she had any telemetry on, check for any abnormals. Now I'm going to listen to your bowel sounds. I'd be listening to see if they're active, hypoactive, or hyperactive, or if they're absent, checking all 4 quadrants. Are you having any trouble going to the bathroom, having bowel elimination? Yes or no? When was the last time you had a bowel movement? Did you have any pain with your bowel movement? Have you been having any flatus? Have you been passing gas? And if they said yes, I could go into deeper questions like what color, how much, what's the consistency, does it have a foul odor? And I know that you're in here for urinary retention. So when you go to use the bathroom, when you're voiding, are you having any pain?
Issues you're noticing?
How often do you
Is there
go?
a change in color in your stool?
When you go to the bathroom, is there a large amount or is there just a little bit? You don't feel like you're going very much?
You're going to seizure
And I could ask the color and not the consistency, the color and the odor. And then I would ask about range of motion, and I would ask them if they use a walker or cane, if they're okay. I would assess, see if they had a fall risk band on their arm, and then I'll check their socks. And I would also ask, do you have any allergies? And I would assess for IV lines, or if they have a PICC line, I would see where it's at, and I would assess it and ask them if it was okay.
Now we're going to the
So,
bed.
but back to range of motion, I would ask them and I would have them show me. I'd have them move their neck side to side and up to down, move their arms, make sure they have full range of motion, or if they're limited, check their arms, and I would also check their legs. And then now I'm gonna check for recoil,
Are you having any
if the vascular recoils, and you can't tell, but I'd press, I look at their nose, then I look at skin tigors, so I'd see if it goes back fast or if it goes back slowly. Now, I'm gonna take a look at your legs, and I'm looking at what their skin looks like, if they have any bruises or any wounds that we don't know about. With the urinary, I'd ask them if they had a catheter, and on the chart it said they did. So I could also look at their catheter that's hooked up. Then right here, they have a bandage on their foot, so it's a good thing I looked. Like I said, I would have done range of motion, so I would know. I look at their feet, feel for their pulse in their feet. I would turn them over and look at their backside, look at their back, see if they had any pressure ulcers on their bottom for sitting too long. And back to their eyes, I don't recall if I said this, I would see if they had glasses or contacts. And that's it. Then I would thank them and wash my hands.